All right, welcome back into Daybreak. A stroke is a medical emergency, as you know, but early action can make a difference. So know the warning signs, and more importantly, make sure you get control of the major risk factors. Joining us this morning, Dr. Devon Ballard with Baptist Health in Sherwood. Dr. Ballard, thanks for coming in. I know that this is something that we talk about every year, but you know, we want to remind people some of the risk factors and definitely some of the causes of a stroke. Kind of break that down for us.
Two main causes of strokes in general. There's the called hemorrhagic strokes and the ischemic strokes. Hemorrhagic is where a blood vessel breaks and your brain has blood in it. An ischemic stroke is where a clot blocks the blood flow to that area and the brain just dies. In essence, so two main causes of strokes are those. How do you prevent those, or what do we do to treat those? A lot of times stroke symptoms come in and people are maybe slurring their speech or acting kind of strange, or actually might pass out. Usually we'll go to the ER and they'll actually usually scan their brain, and if it's a ischemic stroke, they can give a clot buster to actually sometimes open that clot up immediately and recover the brain. But you don't want to do that if somebody's had a bleed in the brain, because that can make it worse. So they have to make sure they know what kind it is first. So it's treatable at certain times. Multiple risk factors for stroke that we talk about, you know, smoking, high blood pressure, high cholesterol, diabetes. We try to maximize the control of those conditions to help prevent strokes if possible. So it's an important thing to see the warning signs. If you're not sure, always go to the hospital or call the doctor. If you're not sure, it's better safe than sorry, because we always like the false alarms.
Definitely.
We always like, hey, it's not a stroke, that's good. But if it is, we can sometimes treat, do early intervention, and get pretty significant recovery in a lot of stroke people.
You mentioned some of those risk factors, including high blood pressure, high cholesterol, things that you should get checked out once a year, bringing up the importance of making sure you go see your doctor.
You bet. I mean, maximal control of the risk factors of, you know, I have a lot of people come in, it's like, I don't want to take blood pressure medicine, I don't want to take cholesterol medicine. A lot of people have a genetic condition where they could be marathon runners and have cholesterols of 450. They can have the 16-year-old football player with blood pressure 160 over 100. They can't do anything about it. They're going to have to be on medicine forever. It is controllable, but denying that I have a problem and I want to take something is something we hear a lot. We try to do the best we can, and I don't like putting people on medicine, but sometimes that's what we need to do to help control, to prevent these things happening later in life.
Which could save your life, obviously.
For sure.
Okay, Dr.
And smoking.
Yes.
No smoking. That's a big deal, too.
Can't stress that enough, I know.
Yep.
All right, thank you so much for coming in, Dr. Ballard. Really appreciate it. Happy Thanksgiving to you.
Thank you. You too.
All right, for more information, you can always call Baptist Healthline 1-888-BAPTIST. And coming up next,